stars, rock and rolling through the cool guitars. Chuck's got the questions, digging so sharp, peeling back layers, hitting the heart. Chuck Shute podcast, blowing your mind. Every topic, one of a kind.
Obviously, things have changed a lot since you were here last 9 months ago. So now we're changing the whole landscape of the health and human services. We got RFK. Now, I don't think we talked about him too much last time. I mean, are you a fan? Do you think he's doing, because it seems to be, for some reason, he's controversial to some people feel like he's anti-vaccine or he's anti-medicine or anti-medical establishment. What are your thoughts?
Well, when we spoke last time, we talked about how this is a chronic disease, particularly obesity caused by our food, is a national crisis, a shorter lifespan, kids who are sick, but it wasn't a political priority. And that's
Right.
entirely changed in the last 9 months. It's not just me saying it wasn't a political priority. The newspaper, the Washington Post here, did a year-long investigation and about the problem we were having with food-caused chronic disease. But their final piece was just that it wasn't a political priority. And at the time, it wasn't being discussed by either presidential candidate. And they did a survey of members of Congress, and just a handful said it was a concern. And remarkably, that has changed, and RFK Jr. is the reason for that. So the movement that he has coined is the Make America Healthy Again movement, and the priorities that he listed, there's a Wall Street Journal op-ed he wrote when he endorsed Donald Trump that laid out 12 policies that he felt would define Make America Healthy Again. And I looked at that list and I agree with almost all of them. And so that I've been a big fan. But you're right. You know, I like to cite his own words. In his own words, RFK Jr. has said that, acknowledged that he has skeletons in his closet. In fact, so many that he could get, if they could vote, he said that he would get elected president, king of the world or something, were his exact words. So he is a controversial figure. He's and vaccines is top on that list. But the Make America Healthy Again movement, the people in that, I know many of them are calling for the right things in terms of our food, the chemicals in food, and doing something about it.
Yeah, because I mean, it's interesting. I hear I understand people's concerns, because it is concerning if he wanted to ban the measles vaccine or some of these vaccines that are very useful, I think, that are helping people. But I have just not heard that. I've listened to hours of interviews with him because I think he brings up a lot of interesting points. I don't think he's ever said he feels like we should ban vaccines. I think what he's repeatedly said, that I've heard him say in interviews, I don't know, maybe I didn't listen to every single interview, but he's repeatedly said he wants to make vaccines safer and a higher quality and make sure that they are not having side effects. Maybe there's some ingredients, some of the preservatives in them that don't need to necessarily be in there. Like maybe they wouldn't have as long a shelf life, but they'd still be effective if we took out some of these preservatives. I mean, I don't know. I don't know the exacts, but that's just what he said that he wants to look into. Is there side effects? And then even if he said, well, even if we find side effects, we're not going to ban it. We're going to let people make their own decisions, but we're just going to inform you that, hey, you know, you might run a 1 in 100,000 chance of this happening, but at least then you would know, and then you could make your own decision. Because, you know, 1 in 100,000 chance of dying or getting cancer versus, you know, 1 in 100 chance of getting a disease that could potentially disable you or kill you. I mean, that seems like a pretty clear-cut decision for most people.
Well, you're right. And that's, you know, at the core of focusing on vaccines, because vaccines really work by creating what's called herd immunity. So everyone gets vaccinated and the disease really doesn't have a place to get a host and get a foothold, and you eradicate these. And we've eradicated a smallpox, for example. And really in the United States, we'd eradicated a measles, a disease that can make kids sick, kill kids. But yet right now we have beginnings of a raging number of cases in Texas that would be unheard of just a few years ago. And so here's the problem with it. If it doesn't take a lot, if 10% of people, if you raise doubts that are not, you know, 10% of people say, well, I'm not going to get vaccinated. Now you create these opportunities for these footholds. And if I could, just back up a step, Chuck, vaccines by their nature, particularly if you're going to vaccinate, in a country of 330 million people, if you're going to vaccinate tens or even hundreds of millions of people, humans are each uniquely different at some levels, and you're going to get various results. So I can pretty much guarantee if you vaccinate 100, 200 million people, some people will have reactions so severe that they're going to die of almost anything.
Right.
And that's been understood about vaccines from the beginning. And so, along with vaccine programs, America has a vaccine compensation system that the federal government runs. And I think it puts out as much as 8 billion with a B a year in compensating people who are harmed by vaccines. And it's rare, extremely rare, like you're saying, 1 in 1 million. These are rare events. But if you ask the question, is there anyone who's ever had an adverse reaction? You're going to get yes. Have there been severe adverse reactions? Yes. But, has anyone died? That may even be possible too. And that's why we have a compensation system, because in return for all of society being protected, we recognize that a few people might be harmed. And then the government has put in place a compensation system to compensate them for really a service they've provided, a tragedy for them, but has helped us as a nation save many other lives. And the way I like to think of it, I have kids who've gone through school. I know that people are harmed by vaccines occasionally, exactly as you were doing when you do the numbers, 1 in 1 million versus 1 in so many hundreds. What you experience is that in all the years our kids were going through public schools, I don't recall a single instance where one of their classmates had been harmed at all or severely, certainly not killed because they took a vaccine, even though every single one of them in all those 12 years of school were vaccinated. There wasn't a single case that I was aware of a parent whose child was harmed or certainly killed by a vaccine. That's the status with, again, they were happening. They happened in other kids' classrooms. It's very rare.
Yeah.
If 10% of Americans or 20% just decide because of the questions being raised to stop vaccinating their kids, again, what we know from science is that most families will know someone who died because they weren't vaccinated. Rare again, maybe one kid, not every year in your child's class, but in the 12 years your kids go through school, you'll know a few kids who's died because of not being vaccinated and getting these diseases. And so that's what concerns people. That's what we worry about. Vaccines have always had side effects. And we've dealt with that by creating this compensation system and educating people. But, reopening it and saying, gee, there's this risk, and we're just going to educate you. And if you don't want to do it, you don't have to do it, creates all of these openings where these small epidemics, maybe even larger, will take hold.
Yeah. Well, I think it depends too what diseases you're talking about, because some of these vaccines are kind of optional, right? I mean, like a flu vaccine is not necessarily required, because a lot of people are going to, even if you get the flu vaccine, you could still get the flu. It just wouldn't be as bad. So, I mean, they recommend the flu vaccine for, I don't know, whatever age group. My parents get it because they're older, they're at risk. But I mean, the number of vaccines that kids are getting, it's so many. Do we really know the long-term effects of having all these different vaccines? And I don't know. I'm not saying I have the answers, but I think RFK is saying the same thing. I don't think he's saying I know the answer. He's just saying this is something that we should maybe look at and investigate, like a kid that gets 40 vaccines versus a kid that gets 5, and then follow their health for 40, 50 years and see, is there differences? Maybe not. Maybe the kid that got 40 vaccines is way healthier and lives a healthier life. But it would be interesting to look at and see if there's any differences.
Yeah, those are great points. And we do that, but it does take time, as you're noting, especially if you want to look 40 or 50 years.
Right.
But here are some distinctions I think that are important for people to know. And like you said, not every vaccine is mandated. Many vaccines, people have a choice whether they want to take them or not. But here's one we've all recently experienced that has raised some controversy: the COVID vaccine. And so at the time, I'm an expert in these areas, a trained public health official. I've served in senior government positions overseeing public health. I was vaccinated with the COVID vaccine as soon as I could because I felt like I was in a group that might be at risk, and I familiar with the technology creating the vaccine. I'm familiar with the testing a vaccine would go through. I knew that there was some risk, but I knew that the risk for me, I felt, was greater by not being vaccinated. And in particular, in our case, I'm so fortunate, lucky. My mom's now 102. She was just under 100 then, and she was staying with us. And I certainly didn't want her to get sick. So I wanted to take every precaution. But some of my friends would, this somehow became somewhat politicized. And some of my friends would say, this person's not getting vaccinated. They're dumb or they're bad or something. And I'd point out to them, at that point when most of us were getting vaccinated, the vaccine was under what's called an emergency use authorization. An EUA government, we have acronyms for everything, but an EUA, an emergency use authorization. What that meant was the company came to FDA and said, this vaccine has been through a lot of testing already, but it's only been a year. We only have a year of data. And so we want to make it available to people, and we have this EUA. And indeed, some places started saying, if you want to be here, you need to get vaccinated. But I would quickly defend anyone who's, in normal circumstances, if a vaccine was under an emergency use authorization, I wouldn't be getting it yet. I'd be waiting till there was more data. But we were in a crisis. And so your point's exactly right. People need to understand, where are we in the evolution of this vaccine and its history? How many years of experience do we have? What do we know about a lot of times it's what do we know about the science? And what are the things that could be unexpected that could happen or not? These are all important questions. But it's fascinating. If your listeners want to go back at RFK Jr.'s confirmation hearing at the end, he had this dialogue back and forth with the chair of the committee, Senator Bill Cassidy, a physician, a Republican from Louisiana, and they were having and Cassidy's has treated a lot of patients, people who've been vaccinated, not been vaccinated, and he simply made the observation that there are different roles in society. And if you want to be the Secretary of Health and Human Services, your guiding star has to be sort of what he called the preponderance of the evidence. And so your job is to sort of look at all the evidence that's out there, bring in all the experts, reach a decision that we have to go with is the decision for society, and do that. And once you've done that, your job is to defend that and move on to the next issue. But there's a preponderance of science. That's what it states. That's what we decided to do. There is another role in society that is equally valuable, important. This is my term for it, but a gadfly. Somebody who wants to be, always asking questions, always sort of raising things, making sure we're honest about everything we're doing, wants to be the person that kind of keeps asking questions and really can never satisfy them, because every question you answer, they'll always find another question that they can ask. And Cassidy said to RFK Jr., that person's really important in society as well. But you don't want that person as the Secretary of Health and Human Services. And so you need to decide which role you want to play in society. If you want to be the person who's always asking the questions, super important. We need those people out there. Be that person and keep pushing, asking the questions, and keep us thinking. It's great. We need that. We want you there. But some things we need to settle so society can move on to the next thing. And that's the job of the secretary. And so the secretary needs to kind of bring everyone together, bring all the evidence together, and make a decision. And in some cases, it may be, we just don't have enough evidence yet. We need to wait. But in most cases, we're going to need to reach a point where we get enough evidence. And I think people worried that in RFK Jr.'s case, because he's done this for decades, it appears to them that he never reaches a place on any vaccine where he would say, this is safe and we don't have to worry anymore. He always wants to raise one more question. And so that's what I think concerned people is, which role does he want to play? Both would be enormously of value to society, but they are different roles that the country needs.
Yeah, it is just interesting because, just even pulling back looking more of a global lens on this whole issue. Besides just vaccines, all these things he's talking about, we spent pretty much a whole episode talking about ultra processed food last time. And then, he mentions electromagnetic radiation, glyphosate and the pesticides, artificial food additives, SSRIs and antidepressants, and microplastics, and more things. There's a lot of things that are going on, a lot of moving parts, and it does seem like we do need some sort of change, because are we the unhealthiest country in the world, or something? We spend more on health than any other country, and I think we're one of the unhealthiest countries in the world.
No, we are the unhealthy among the nation, the wealthiest nations of the world. I don't know if it's a dozen or top 20 wealthiest nations in the world. We're dead last.
We're dead last.
By a lot.
So that's super concerning. So maybe trying something somewhat different. I mean, I'm not saying ban all vaccines, ban all processed food. You can't just, I don't think banning everything is I don't think that's what he wants to do, but I think making some changes, looking into some of these things, and I think the biggest thing is just, the thing that concerns me is the corruption. And I feel like and I think we talked about this too, because, you worked in these agencies and then you went into education, which I think is very noble. But I think there's some people that they're going to work for the food corporation. So, they've got, it's kind of it's basically corrupt, in my opinion, that they are working with the food agencies and then policing them. So some of these ingredients that are in our food and such may have been approved, and maybe we jumped the gun on some of this stuff. And it could be the same for the vaccines or other chemicals or levels of electromagnetism from our phones and computers. Like, I don't know. I mean, I hope that our phones and our computers are safe, but we sure are spending a lot of time on them. And we're the unhealthiest nation. So something's got to be the cause of that.
No, those are great points, and I think people should ask that. A lot of people are, and I think that's where "Make America Healthy Again" MAHA comes from, is that we are so sick as a country. It is a true grassroots, movement that's occurred, and it's occurred because so many Americans are sick. So many Americans are experiencing what you just talked about, and that's where the movement comes from. When you're in a country where literally more than half of the people have a chronic disease that seems likely caused by our food, that is something that should reach a point. And for me, in working in as a professional, I kept waiting. I'm working on policy, but I was like, where's the grassroots? It's got to be here any day now, because so many people are being harmed. And as I pointed out last time, particularly because how many kids are being harmed. The fact that 20% of our kids have obesity, another maybe 20% have prediabetes or more. A government report just came out saying it's closer to 40%. That should never happen. Yeah. And so that's what, for me, though, that there's a way to, what do we do about this? Well, that's what science allows us to do. And so the Make America Healthy Again movement, and RFK as its leader, it's why I pointed out, he had this op-ed in the Wall Street Journal. He listed a dozen policies. All of those, I go through it. It's focused on, to answer your, why it's chemicals in our food are a big piece of that. But it's not vaccines. Now, vaccines weren't listed in his dozen there either. But he does have a long record on it. So that was what gives people a pause. But he didn't.
Why do you think vaccines are not a piece of it? If the vaccines, it used to be like when I was a kid, I think you got 5, and now it's like 100 or 40. The number has drastically increased. And I think he's just questioning, do we really need all of these? Like, I think one of the vaccines they give is for, they give babies at birth a vaccine that's like, it's one of those STDs that, a baby's not going to get an STD.
I think it was like hepatitis or something. It actually came up at his hearing. We had a conversation about it.
Yeah. I
think that, again, these are great questions that people should want answers to. And I think the reason you said, like, right, when we were kids, we got fewer vaccines than today. Right. The reason that there's so many more today than then is we learned that, vaccines are a really great, effective way to prevent a lot of illnesses.
But also they make a lot of money. Isn't that, that has to be something that's a piece of it that may cloud the.
No, I don't think yes, but not vaccines per se. So it's not that, if I'm looking to make a lot of money, vaccines are the place to go make it. Because as I said, vaccines also have high risk to them in terms of that if you're going to, so the nature about a vaccine is that you're going to give it to so many people too, right? And so when you do things at a population level, the odds of something going wrong on a few people become much higher. That's why there's a compensation system. But even though and that's what you need for companies to do this, because it wouldn't be a big money maker if every time someone was hurt, they had to pay out for it because of the nature of it. So I think you have to look at each thing as it is. And I think with vaccines, so your point though about, there's money in it, where I want to strongly agree with you is in our sick care system. And so that part of our healthcare system that really just profits when you're sick, and it's where the biggest profits are. The fact that you're taking all of these drugs when you're in the hospital, all of that, it's a moneymaker. And it's why, we don't prevent disease. We wait till people are sick to treat the disease because a lot of people are making money on it. So I think at the higher level, your concern that in America, our healthcare system is a sick care system that makes most profits when people are sick is something we should all be deeply concerned about and ask questions about. Is this really the right way to do it? The areas of prevention, which is where vaccine falls into it, I don't think people are making just big money on that. And, again, they're certainly making some money on it, but I think it's more a matter that there used to be a few vaccines. It was seen as such an effective way to prevent a lot of diseases. We kept creating new vaccines because we could also prevent this disease and that disease. And so that's what explains. It's not that they're now making a lot more money. It's that we're able to prevent a lot more illnesses. And so let's just do that. Now, you're also right to point out, is it necessary to give it right then? And, again, people are always they're collecting data. One of the whole idea of not only do you have to get, when you're getting something approved at FDA, like a vaccine, the first few phases of review that first make sure it's safe to use in someone who's healthy, then make sure it's safe to use in someone who's sick, then make sure it's safe, it's effective. It's not just safe, but it actually works. And then you get it at that stage, you get it approved and can start selling it. But then there's another phase after that, whereas you have to keep collecting the data on the people now that you're exposing that many and make sure that you report any adverse outcomes. So we can see that over time that, once this has gone from a few hundred or 1,000 people in a study to millions of people, the results don't change. And so we're doing all that. And as a result, we know that vaccines, even given together in large numbers, are broadly safe. But I think the key thing is what I said before, is though, individuals, as they'll experience it, if you're going to vaccinate a large population of tens or even 100 million or more of people, there will be people who are harmed. It's just even when it's a 1 in a million risk, when you're if there was a 1 in a million risk of dying, which is really small, but you do 100 million people, 100 people will die. People hear those stories and that kind of, gee, I know this person. Well, and it's just understanding the level of risks. So I think we do know the science. I do think we need to worry about conflicts of interest, particularly in healthcare. I just don't think vaccine is the place.
I don't think, and I think it is very rare to die from a vaccine or to have some sort of allergic reaction. It's rare. I'm more concerned about the long-term effects, and not just the vaccines, but all pharmaceuticals, all these food additives, like everything that we're getting. Because you just look at all these young people having disease. One of the first that was so crazy to me was Michael J. Fox getting Parkinson's in his 30s, I think it was. Maybe it was his 20s. He was super young, and I just thought that is insane. And then, I just recently turned 45, so I had to do. I guess they changed the colon cancer screening. It used to be when you were 50, you had to have a colonoscopy. And I didn't know that they actually changed it to 45. So I was scared, and I was scared to get one because then you learn about, there's a couple celebrities, James Van Der Beek, super healthy actor. He got colon cancer. And then the guy from the star of Black Panther, I'm spacing on his name right now, but he got colon, and this guy, he's just super healthy, ripped looking guy. He got colon cancer, diagnosed at 40 and died at 43. It's just super. And then there was just an article today about the rising rates of breast cancer among women under 40, which so all these diseases in young people, like you said, the children too. When I was getting my colonoscopy, the lady said, yeah, there was a kid that was 8 years old that had colon cancer. is super concerning. I don't know what the cause of it is. I don't know if it's a combination of all these things, but it is definitely something that I hope that RFK can get to the bottom of.
Well, I agree with you, and that's why I'm a fan of the MAHA movement, and because and particularly I believe that chemicals in our environment and in our food are probably part of the cause of this. And the problem is that and the question is then, well, what do you do about it? And to
Mhm.
me, the answer is more science, not
Yeah.
less science. And we don't invest in the science that we need to, and in part we're not investing. So, for example, in my field, nutrition, I've looked at this very closely, and as in my jobs in government and as an academic, and I've discovered that the reason we don't spend more on nutrition is because the food industry uses its enormous power to lobby Congress to not fund the
Yeah.
research.
Oh,
I mean, they
really?
literally say, "Don't fund this research because we
Oh,
don't want to know the answers." And so
that's
that's what
scary.
I think should concern people more,
Yeah.
because I think what happens is, and here's the truth: when we study the way we do study chemicals before they're used as pesticides, before they go in our food, but we study them in a really sort of simple way. We look at a chemical, we test it in a model, and say, does that chemical cause harm? And it's more of a direct harm that you take this chemical, particularly you're doing a study in an animal, and you see this harm right away, or some change that's there right away. But what happens, that's, yes, I mean, if you're just using the chemical by itself, but that's, in the real world,
Yeah.
you're exposed to all sorts of
Well, yeah,
combinations.
you're basically microdosing these chemicals over a long period of time.
Yeah, and you're interacting with them, and you need to know about that. And I can tell you right now, as someone who works in this area, we don't study that. We have no idea. So if you're asking, is this chemical harmful if I take it by itself, we can answer that.
Hmm.
But you don't care whether it's harmful by itself or it becomes harmful when you use it with three other things and
Yeah.
this and that. All you care is what the end result is. And that's the kind of thing we know almost nothing about, is the interaction between all these chemicals and drugs and vaccines, other things. And so, that shouldn't be alarming to people. But the good news is these aren't things are impossible to figure out. If you invest in the science to look at these and answer these questions one by one, you can answer them. But you have to
Yeah.
be willing to invest. And instead, we invest much more in treating problems after they're there, because there's a lot of money to be made there. And we don't spend much money trying to figure out how do we learn things so we can prevent the problem.
Yeah. I wonder if that would be something that the RFK could do, like, is to kind of make a section of the government that would be for research that isn't influenced by the food lobby or people that could not go and then work for the food. Like, this would be like a true third party research that would have nothing to gain or benefit from the research they did, just to find the truth. That's what I want to know.
Well, he has that opportunity now. He, as Secretary of Health and Human Services, he oversees the National Institutes of Health, which is a 50 billion with a B organization that's dedicated to funding research at the National Institutes of Health here in Bethesda, Maryland, where I am, and also it has extramurally at universities all across the country. And so he has an opportunity to use that to answer these questions, and hopefully he will.
Yeah, I hope so, because it's just, yeah, the young people, I just don't think that should happen. I don't, if you're
And,
under 50 years old, you should never have cancer. Like, I just don't think that. I mean, maybe
well,
there's,
unfortunately, the nature of cancer is some things do happen, but you're right that
or
the
should be
more important.
rare.
Yes, it should be rare. And there's no question that you look at, we've been making actually a lot of progress in cancer overall in the last couple of decades because we have better treatments. And so there are more people surviving and living with it as a chronic illness. But you have to ask yourself, when they talk about, gee, people are surviving and they live with it as a chronic illness, it means they're being treated all the time. People are making money and they're being treated that way. The thing that is happening is that worried you and it worries me is that more and more young people are being diagnosed with cancer. And so why is that? And that's something, the goal should be to prevent it, not to be able to be ready to treat it.
Yeah, I'm not as interested in finding the special treatment or whatever. I would rather no one ever have cancer. I would rather have nobody be worried about having. I mean, I was so worried to do that colonoscopy. I was like, for sure they're going to find cancer. I mean, I was so scared. It was just, and I don't want people to have that fear. But like, you see these examples of people, young people getting cancer. And so it does concern me. Let's talk about some of the things in terms of nutrition, things that are some red flags. Like I would say definitely, and this is something I probably didn't think about much recently, but with colon cancer is like the fiber. I mean, I guess that the United States consumes the least amount of fiber in the world. The average American only eats 10 to 15 grams, which you're supposed to get, for men under 50, you're supposed to get 38 grams of fiber. I mean, that's a lot of fiber.
Well, that's a good point. Just to finish up our last conversation, we just need to do both, right? We need to come up with the treatments, but we need to prevent it, and we should do both, and we're not. We're focused almost entirely on the treatments. We're doing very little to prevent.
I'm more interested in the prevention, I guess. Is not that
no, and I am as well, and that's the area that you want to do. And it's not to say we criticize. I mean, I want to make sure people are clear. We're not criticizing treatments. Absolutely, we want to come up with those for people when they are sick, but we don't want. We want to also make sure that we prevent it. But to your point, yes, part of the shift in America from eating real food to eating ultra processed food is the lack of. It's more than fiber. It's the structure of the plant that is eliminated in taking that. So it turns out you've heard of the microbiome.
Yeah, that's a big thing that I'm learning about more with the gut health. And I mean, I mentioned SSRIs and antidepressants. I'm learning that the gut health is related to mental health. Like the brain and the gut are talking to each other. And
absolutely. There's a Chris Palmer is a colleague of mine at Harvard, has a book called Brain Energy that's excellent. And that's his whole effort in his area of research and practice is about these kinds of mental health and how it's caused by probably our food. But you're right, so the microbiome, we've known forever, not forever, but we've known for a long time that we have this millions of billions of bacteria, trillions in our gut that are part of, our existence and how we live. Now, for a long time, we just thought they were there. Just for your listeners, that we as humans, we have more of those bacterial cells in our body than we have human cells. And indeed, if you measured them by weight, I think it might be something like 10 pounds of your weight is all of these bacteria in your body. And for a long time, we thought, well, they're just there. They're going along for the ride. They serve various functions. They're there, and particularly the microbiome in our gut. It's there. It enables us to be healthy, but it's just there. But as we learned more about it, we learned that it's not just there. It's actually signaling back and forth with the human cells, and they're communicating with each other, and they're telling them each about what's going on. And here's what happens is that, and this is just a theory because we're still learning about this stuff. But so the microbiome needs its food just like we need our food. So it turns out when you eat a plant, and there's the sort of the physical structure of the plant that, that's there, that the cell wall is just the physical plant itself, that we really can't digest. It goes down to the microbiome and it's the food it eats. And so, perfect kind of system, right? We take out the sugars, the other things out of the food earlier on that we need to get our energy and stuff, but we're not able to digest this other part, the cell walls, sort of the physical structure of the plant. It passes down to the end of our gut where it goes to the bacteria. That's what they use to live off of, and everything sort of works and is happy. Now, what happened is we went to more and more ultra-processed food. They start with the plants, the corn, the soy, the other things, but they process it so much that when they're done with it, there's nothing left of the sort of the structure of the plant. It's just gone. Now, what happens with that is all that's left are the parts we needed. And so we eat the very refined grains and carbohydrates. It goes into our gut. We get the calories and other things we need from it. But the microbiome is sitting there at the end saying, where's our part? There's nothing coming through. What's going on here? Now, it turned out before, in our old understanding of it, that they weren't communicating. Well, we don't really care. It's whatever they'll just do the best they can. And if something happens to them, they'll be replaced, I guess. Who knows? But now we know, and this is just a theory, is when the plant walls and that part of the structure of the plant are not there to feed the microbiome, of course, signals and said, where's the food? And it might up your appetite to see, well, maybe you should be eating more because then I'll finally get what I need. But the reason is not that you're not eating enough. It's just that you're not eating because our foods have been changed so much. You're not getting what you need to feed both your body and your human cells and the microbiome. But because the microbiome is communicating with the human cells, it may be upping your appetite in the hopes that it may get something for it to use to get the energy it needs. And so these are the things we need to study more, and so we can figure out. And these are the things the government should insist upon food companies to figure this out, and then make sure they design, when they're designing ultra processed food, make sure that it's feeding both the human and the microbiome in the human.
Yeah, that's interesting. And then, I mean, because you look at vitamins and minerals, like, I mean, I think, back in the day, it was like they figured this out, like people that go on ships and they'd get scurvy and they didn't know what's wrong with them, and then they figured out if they ate fruit, they would be okay. And it was so with the vitamin C deficiency. I don't think we have a lot of vitamin deficiencies in America now because everything is fortified. So, but do you think that maybe or maybe there's some minerals and things that people are lacking? Definitely, like I said, the fiber. I know that's one, but do you think too there's the problem of maybe people were too fortified, people taking all these supplements and all these like energy drinks and stuff loaded with vitamin B so much? Like, can you have too much? Is that hard on your kidneys or your liver or however it's processed?
Well, I think you're right that we do have too much. In terms of the harm, I think the number one harm from too much is you're wasting money. You're paying for things, you're taking them, you don't need to do them.
Like but my nutrition teacher used to say, we have the most expensive urine in the
world. Yeah, that's exactly what that is. There's some of the vitamins, ones that are called fat soluble vitamins, like vitamin A, where you can get too much and it will do harm. And so there are some things where you can get too much. Some minerals and things, you get too much. You can get kidney stones, for example, as a result of that. So overall, in general, too much is usually not a problem. It's usually, as I said, more like exactly your words. It's expensive urine because most of these things, but there are some that do collect in the body, either because of their fat soluble or other reasons. And those can be too much and they do cause harm. And so we do need to be concerned about that. And again, we need to make sure we have the science to understand what's the right level and balance.
Yeah, I wonder if that's too just because these foods were designed, like if you eat an apple, it's got sugar in it. And so you're like, oh, the apple's bad because it has sugar, but it's got sugar and it's got all the fiber. It's like they were designed with all the whole package. But then we strip things apart, and then it's like, and then we give you a big giant shot of vitamin B or whatever, and then this and that, and you're missing the other parts of it. It's like it just seems like we're kind of like messing with things, and maybe that's what's causing the disease. I don't know. I'm just wondering.
Well, I think you have to, I think we aren't the most humble species. And so we often have a sense that we know more than we know. And so we learn something. And so, for example, what you're talking about, vitamins and minerals, and also even protein, some of the macronutrients. And so we talked about a little bit about this last time. They were a Nobel, people used to think of food as food. And then we started realizing that there was a starvation in the world. People worried 1 billion people were going to die because they didn't have enough food. And Nobel Prize worthy discovery that, food is actually in nutrients. It's vitamins, minerals, protein. And so by doing that, we were able to help prevent those 1 billion deaths never occurred. And vitamins and minerals as a way of another paradigm of looking at food as these nutrients, again, was Nobel Prize worthy, served that purpose. But as starting really in the late 1960s and beyond, scientists also observed that, our threat going forward wasn't so much that we're going to starve anymore. The threat is that we're going to get these chronic diseases. And they predicted everything that's happening today. You go back and they said that, in the future, it's going to be obesity, diabetes, heart disease, cancer, that's going to be caused by our food, that are going to be our great concerns at a point in time where these things occurred infrequently, but they weren't a problem yet, but people predicted that it would. Now, I bring that up because as we've gone forward, the nutrient model hasn't done a great job explaining the relationship between our food and chronic disease. And vitamin is a great example. Not so much that it's too much, but of course people felt like, well, we know from the studies that people who eat a lot of fruits and vegetables have a low rate of cancer. And in our not so humble way of doing things, we sort of responded by saying that, well, what if we just gave people the vitamins, these antioxidant vitamins? We can take them out of these foods, sell them in pills, and we'll prevent the cancers and do it that way. And we'll achieve the same effect by eating produce, and you just take it in a pill. Well, what we found out when they actually did those studies, then they found out that actually those taking antioxidants make cancer worse.
Oh, shit.
And
Wow.
it turns out because what is a cancer? A cancer is, in a way, this is kind of an awkward analogy, but it is almost like a bean growing in your body. It doesn't take on the form of like a baby or something like that, but it actually creates its own systems of circulation, other things, lives off your body, and eventually, in trying to get everything it needs, kills your body. And so it needs a nutrition system. And it turned out when you take mega doses of antioxidants in the hope you are preventing cancer, you're actually feeding the tumors.
Wow.
Because your body didn't need all that excess nutrition, but the tumors made use of it, and it actually made it worse. And so that's why it's important to do the science and keep doing the science. When you first see this first indication that, people did the study, they said it's a produce. You think, well, what's in produce? It's just vitamins. But as you're pointing out, it's a lot more than just the vitamins. There's a lot of other components there. They're the nutrients, and there's a lot there that aren't nutrients.
Yeah. Have you?
And that's the part we don't really know. So you look at a food, there are a few hundred nutrients now that we've characterized that we think of as nutrients, but there are literally tens of thousands of chemicals in foods, not chemicals that people are adding, just the chemicals that nature puts there. There are all these different chemical compounds in foods. And then there are just structural things, like I was talking about the microbiome. There's the structure of food matters as well. And we don't know very much about that yet. We don't know how to make a man-made food that we will thrive on. And we need to be able to do that at some point. But we need to, we don't today. And so we really don't know enough about what is going to make us sick or not sick in food. And we've let food companies just ignore that in designing their food. We've let them sort of say that, all right, I'm going to design a food, but the only thing I care about is making a profit. And therefore, the only thing I care about is the taste, cost, and convenience of the food. When you as an eater, of course, care about taste, cost, and convenience, but the number one thing is, am I going to thrive on it?
Yeah.
Or is it going to make me sick? And companies just ignore that when they're designing a food because they have no incentive. It doesn't happen. If it doesn't happen right away, if it made you sick right away, they worry about it. But if it's going to, within 10 years, it's going to cause a cancer, or heart disease, or diabetes, or obesity, they're like, that's not up to us. We don't worry about it.
Well, exactly. That's the thing with the immediate, because I don't know if you've read this book, The Dorito Effect.
Yeah.
But I had this guy on there on my podcast, and I can't remember the thing, but there was some issue with bread like a long time ago. And so we were lacking the B vitamins. So in America and Italy, they had two different ways to deal with this. In America, we said, oh, okay, we'll add those vitamins into the bread. And in Italy, they said, oh, okay, well, we'll just have people eat rabbit meat or so. They handled it all naturally. And you saw how those two things, the way we handled it, and then we started getting obesity and all this stuff. In Italy, like, these people are eating bread and pasta and wine, and they have lower rates of obesity. And so maybe we screwed up there.
Yeah, no, exactly right. The 1940s, in the bread industry and the pursuit of packaged, sliced bread that's convenient, easy to eat. It's a remarkable story, right? Because someone invented a bread slicing machine, and then they had to figure out, well, all right, if you're going to slice the bread, that's great, that's really convenient. But then how do we keep the bread from being stale between each slice, right? Because when it's whole, but now every slice has to stay fresh and soft. So we have to come up with chemicals to do that. And then, oh, by the way, if you put the normal loaf of bread out of the baker into the slicing machine, it just crushed it. And so we need the bread to be a little sturdier so it stands up to the slicing machine so it can slice it. So we put all these chemicals, we did all this processing to get to this food. And then by the 1940s, we realized that, wait, people are getting sick because in doing all that, some of the vitamins are missing. And so then we actually go back and we say, well, all right, now we're going to require by law that you fortify the food by putting in these vitamins. But first of all, as we were just discussing, well, what else is missing now that we don't know about? Well, we don't know what we don't know. And so we didn't deal with that. The vitamins weren't the only problem. And it's kind of crazy that, you start off with a food that allows us to thrive. You process it in a way that you learn it's missing certain vitamins, and your solution is to put the vitamins back in. And that's going to solve the problem, as opposed to figuring out how do we have a diet that makes sure we have all the things that we need. And so that's, that I think you're right about to raise that, because I think other countries have done it differently, where they really do value, food, as
Yeah.
opposed to this highly processed version of it that, where it's taste, cost, and convenience is it's being driven by that.
It is interesting too, because I thought, well, Europe had banned a lot of these ingredients and additives. They have lower rates of obesity. They're healthier than us. But then I looked up the cancer rates, and it's kind of like 50-50. Like, I think, I can't remember. I want to say it's lung cancer is higher in Europe, but colon cancer is higher in America. Like, it's like some of the cancers are more prevalent in Europe and some more in America. It's really interesting. I thought, Europe was way healthier than us, but in some ways they're not. It's so I don't know. It's still kind of a puzzle with all this.
Yeah, no, I think there are a lot of different variables that affect different populations. Of course, while Europe does eat better than us, they also, all the developed countries have high levels of ultra processed food there now. So you have that there. But you also, there's air pollution. There are other things that factor into it that you have to look at as well. There are genetic factors that factor into it. But these are things that, how do you get answers, right? That there's so many questions as you start looking at what you experience. It raises a lot of questions. And I think, where as a society, what we need to do is to sort of say, we can answer these questions by investing in the science to get the answers, or we can kind of just say, this is what Chuck and Jerry sort of, we can compare notes and then reach a conclusion based on our own experience. This both happened to both of us, so it must have been this. We both went here. This both happened, and I think that kind of experience, what we each experience, is a great way to, in the scientific work that I do in academia, that's how you generate hypotheses. You experience something in life, you kind of you think about it, and you come up with this question and a hypothesis about how you would answer it. So I'm seeing this, I'm thinking about it, I'm looking at all my knowledge, and I think this is what's going on. But what we need to do is we need to then do the next step with a hypothesis, which is to then test it in a study and find out, is it right or not? And I think what happens more and more is we don't invest there, because there's not a lot of money to be made in just answering these questions. And so we invest the research and money to come up with the next drug or something like that, and say, hey, well, what's the, why do you want to just prevent this disease? There's no money to be made there. Let's just let the disease be there. Let's come up with the treatments, and we'll make money on that.
Yeah. I mean, what are your thoughts on red meat and meat? Because that's one thing that there's a lot of, I don't know if you call it misinformation or difference of opinion or whatever, because I mean, there's like vegan diet, and then there's this full on carnivore diet. I mean, I think they're both kind of extreme for my personal choices, but I do feel like maybe we've been sold a little bit of a lie with red meat being so bad for you, like avoid it at all costs. It does seem like there is some benefits to eating red meat, at least maybe in moderation. Because I just know too, like if I eat red meat, I usually feel pretty good. Like if I eat steak and eggs, I mean, it's kind of like an energy boost a little bit. I mean, again, I don't know if I'd want to do that every day or 3 times a day like these carnivore people, but what are your concerns with red meat? I think it scares me that they say red meat can cause cancer. And, but I just don't like, I feel like red meat is safer than processed food. I don't know.
Yeah, no, that's a great question, and there is a lot we know, and there's some that we don't know, and I think that first of all, red meat. We'll walk through the various things. So when cancer, I don't think red meat really. There's much saying that it causes a cancer much, but processed meat causes cancer. So processed red meat, the sausages you get, the hot dogs, unfortunately, the chemical additives that they use to create those,
the nitrates are really bad, right?
Yeah, are pretty bad. And what's happened is companies, they say that they don't add the nitrates, but then they use other like celery, salt, natural things that basically end up creating the same chemicals in the food.
Oh,
and
really? So that stuff that's when because you see that I don't eat the
no.
really?
Read it. You'll see they just use other natural substances
So
that create the
celery,
nitrates.
that's the same thing.
Yeah,
Oh.
unfortunately.
That's good
And
to
so,
know. I like I said, I kind of
yeah,
just
so you don't
avoid
want to, I
red
think,
meat
you know,
in
what
general.
we know, right? We know a lot. And so here's, you know, the quick rundown for you listeners. The number one thing we know that makes us sick are sugar sweetened beverages. And so if you're going to do one thing, particularly if you have children, you know, the beverage of choice should be water, just what comes out of your tap, really, for most people. Some
Because
have.
people think apple juice and orange juice is healthy because it's juice, it's fruit.
No, you know, it's interesting. The science has evolved and groups have, so that you have the American Academy of Pediatrics, other groups. In fact, they just put out, I'll send you, you know, a document where they looked at beverages and what kids should drink and not drink. And they said that, you know, tap water and some amount of white, you know, unflavored, unsweetened milk is fine if you want to. If you have an allergy against it, of course you don't. But water should overwhelmingly be the beverage. And they note that, you know, fresh juices, now these are 100% juices, not the ones that are just 5 or 10%, mostly sugar. But even the 100% juices should be drank in moderation. And there's scientists out there, one of the great experts on sugar, Rob Lustig out in California, he would say that you shouldn't drink fruit juice at all, that it's just,
Yeah.
it's, you know, eat an apple, yes, have an orange, yes. But once you squeeze, again, it goes back to the plant
Yeah.
walls, the things we were talking about
Yeah.
before. Once you remove most of what's there and just left with the juice, it tastes good, but it's mostly sugar, and it's not that different than the sugar that's, you know, table sugar. And so if you really want to, if your body is sensitive, and that's the final point I'm making this answer to answer your question, is there is a lot of variation. And you do have to, you know, there's an area called precision nutrition. We're decades away from really fully, but there is an element that you have to also, in addition to what the advice is, you have to kind of be in tune with your own body, try things and see what works and
Mhm.
doesn't work for you. And now here I'll to answer your question on red meat. So do we need red meat? No. It is a great source of protein if you want that. There's also plant protein. I think the number one in America today, the number one argument for not eating red meat is going to be the impact it has on the climate.
Hmm.
And so, you know, when you look at all the different sources of protein and food that we could get, the way that cattle are raised and the energy that goes into that, the water that goes into that, the methane that they create as animals, and just their natural, you know, state of digesting the food they have, and you know, they create a lot of methane and they essentially fart that out. But when you look at the process of creating red meat versus anything else, it's just so environmentally intensive that it's not a sustainable way to eat.
Isn't
But
that the
that's number
same
one.
with some of the vegan stuff too, though? Like in terms of the almond milks and stuff, because how much water does it
Yeah,
take
no,
to,
you're right. You need to
yeah.
look at all, and so when you're weighing the energy cost, environmental costs, you need to look at all those things.
Yeah.
And people have, and when they've done that kind of analysis, everything has its cost to a degree. But you're asking, you know, why do you hear a lot eat less red meat? I think initially, so here's the other reason you should eat less red meat, but just to be clear about it, the other reason is that it's related to saturated fat and heart disease.
See, and that's where the carnivore people will say, no, that study is wrong. It's all about sugar. The sugar industry paid off those studies.
Yeah, see, it's complicated. I agree.
Yeah.
And so, but this is my expertise. And so what's wrong, what they're referring to is not the saturated fat. They're referring to fat in general, that fat is bad for us. And so if you recall, I don't know if you know, when I was growing up, the number one, we were all told to eat low fat diets. And in fact, you
Yeah.
know, I had the
I
privilege
remember
of,
eating like the low fat Cheez-Its thinking I'm being healthy, you know?
right, right. No, and for me, it's a bit personal because I had the privilege when I worked at the Food and Drug Administration of designing the nutrition facts label, indeed the graphic design.
Yeah,
So it's
yeah,
an
yeah. That's very
award-winning
cool.
design, and
Yeah.
you see it on every package. But here's the thing about that. You know, I had studied nutrition, but I went to work at FDA. There are a lot of nutrition experts there, and so I felt kind of overwhelmed. What did I have to add here? But when I went to the meetings, you know, I said, "Gee, I minored in art, and you know, I know when you design something like a label, it can be designed so artists know where you look first, where you look second. It's what they do. They, you know, it's been,
Mhm.
you know, confirmed by eye studies following people's eyes, and so what we can do is we can work with artists and come up with a design, and we know where everyone's going to look first on the label. Now, here's why that's useful. You tell us what's the most important thing people need to know about their food, and I'll design a label that makes, and this isn't complicated. You pick up a package of food, you can show it later. Look at the nutrition facts label even today. What's first on the label? Total fat. Now that's because I designed it that way, but that's because back in the early 1990s, people asked, I asked, and the question they said, Jerry, it's total fat, and so I said, okay, let's put it first because that's what people will see first, and we'll act on that. Now that is something that in subsequent science we learned is completely wrong. There's good fats and bad fats, and in fact, you need good fats. And you refer to one of the results of the label, which I feel personally really bad about, which is that a lot of companies, of course, companies are just trying to make money. Consumers all of a sudden are all worried about the amount of fat in their food. And so they're racing to get rid of the fat because they want that first line on the label to say 0, not some high number. And so they're racing to do that. Of course, the question is, well, and we didn't answer this. We should have when we were doing it. If they take the fat out, what are they going to put in its place?
Sugar.
Well, that's what they did. Some sugar, some salt, but a lot of refined carbohydrates, which is somewhat similar to sugar. Yeah. And so that turns out to be things that cause obesity, cause diabetes, the problems we have now. Now, so the statement that the whole fascination with low fat and how that changed our food supply and how that may have made us even sicker as a result, all of that is based in strong science that people have concern about. But then there's a nuanced thing you said before, which isn't true, is people all of a sudden extend that to saturated fat.
Yeah, because what's the deal with saturated fat? I'm very confused.
Saturated fat is the fat that's a bad fat. But
is it though? Because see, why do they say coconut oil is good for you? And that's loaded in saturated
fat. Not really
fat.
necessary. But here's the thing, though. So why is saturated fat bad for you, right? These are things we can look at science and answer that. So we know now that the scientists, they were getting a signal. It wasn't that they just made up that fat was bad for you. They were getting a signal looking at their studies that people that had higher fat diets, had higher rates of cardiovascular disease. And at the time, cardiovascular disease was rapidly growing in our country. You would be worried about dropping dead of a heart attack. That was the thing that more and more Americans were experiencing. It was the big threat. It was the thing we were trying to do, and it's something we've now made a lot of progress on. Heart disease is still up there as one of the top killers, but it's gone way down, particularly these heart attacks. And so, why did that happen? Well, when we looked more at the science, we found out that, and this is going to be a little complicated, but I think it's important to know the facts. Is that it turns out that it wasn't total fat. In fact, healthy fats are good for you. And important for health, particularly the omega-3 fatty acids and some of the omega-6s that are there in the right combination. So olive oil, things like that you hear about, walnut oil, can be really healthy for you. I mean, again, you have to put these things in the right balance. But here's what we know about saturated fat, and as a result, red meat, and why it's good or bad for you. What we learned is what causes heart disease. Well, we learned that there are these lipoproteins as part of fat, and they're high and low density lipoproteins. And this is when you get your blood test done. It's called the LDL you see in your blood test. For a while, we thought it was related to cholesterol, but then we learned later that it's not the amount of your body actually makes cholesterol, and that while high in cholesterol for you measured in your blood is a problem, it's not really influenced that much by what you eat. So again, we went through a period where people were taking the yolks out of their eggs, and I mentioned my 100-year-old mom. She still does that. She's still trying to eat low fat. She's taking the yolk out of her eggs, and I keep telling her, Mom, we proved that's not the case. You don't have to worry about that.
So eggs are okay now, because that's something they've gone back and forth with. So many.
Again, unless you have a particular. So this is the key part. You have to know a little bit about what your health problems and risks are. So here's the thing about saturated fat. So now what we know about saturated fat is if you eat a diet high in saturated fat, high in red meat, it will raise your LDL level if you're sensitive to it. So one thing you have to look at is your LDL level high? What about your family? If you have a family where members of your family have died of heart disease, particularly if they've died of a heart attack when they're not that old, and they had a problem managing the LDL level, then that's something that you should make sure that you're taking care of, not raising your LDL level. And the one thing we know that's going to raise your LDL level is the amount of saturated fat in your diet.
Yeah, because that's what's so interesting is that you see these people that are eating carnivore and they're eating all this saturated fat, I'm sure, with all the meats that they're eating. I mean, just low red meat with butter on it. I mean, that's a lot of saturated fat, but they say they're feeling great. Their autoimmune issues are cleared up. And so I don't know if this is a placebo effect. I don't know what's going on, but it's really interesting to see.
No. And here's the other thing about it is, so first of all, you have to know is, what is the relation to what is heart disease as a risk for me, which I can tell both in my own tests that they do on me and my family, and is LDL levels related to saturated fat a problem for me? And now, even if you know all that and you find out, gee, I do have not a serious problem, but we do have some heart disease in my family. This relative did have a heart attack at a somewhat young age. My LDL, actually, when I went to the doctor and he tested my blood, the LDL level was sort of up a bit. One way you could manage that is in your diet. You can start going on becoming a vegetarian, and you'll see that LDL level come right down. You could also, though, take a statin. Kind of drug.
I'm worried about the statins. I feel like those.
But those are the choices people have, right? So you might see the person who you say is with the steak and the butter. Now it may be that they also don't have a family history of heart disease, and it may be that they're not particularly sensitive to saturated fat and LDL, and it may be they're taking a statin, and so they don't care that much.
Well, and I think the other side of that is that a lot of people are not eating as much saturated fat. And now we're seeing increased Alzheimer's and these kinds of things, because isn't there a connection between your brain needs some fatty acids and cholesterol to make the whatever the cells in the brain or whatever, the brain is fueled by fat and cholesterol, right?
Yeah, no, and again, and there's fat and, there's fat and sort of even saturated fat. You mentioned coconut oil before and plant as well. But you can eat, I think what the evidence shows is you can eat a plant-based diet and be completely healthy and live long.
Did you eat a plant-based diet and have a heart attack? Like if you ate a lot of coconut oil, could you get a heart attack?
Yes, it will raise your LDL level if you're someone who's sensitive to it. But you raise points, a lot depends on, and it is a challenge. So I work in public health. And with that, my patient then is a population, sort of millions of people at a time.
Right.
And one reason I work at that is it's somewhat simpler. So the studies are there, and I can tell you if you have 1 million people and we do this, what's going to happen to 90% of them. And that's sort of good enough. So if 90% of people out of 1 million do this, this is the result you get. That's good enough. The data and studies we have often allow us to say that. Now, what gets more and more tricky is what about you? And it's why I didn't become a physician, though I have enormous respect for them. What about Chuck? What's going to happen to Chuck? And in fact,
that's what I think we're not doing is we're not individualizing healthcare for people based
we're
on
working on that, but we have there's a lot to learn, and it's a long way from that. But I once had a colleague who came to me and said, Jerry, I'm having trouble with my diet. I really want to eat healthier, but I'm having trouble being motivated. And I have grandkids. And if you tell me that if I make these changes in my diet, I'll live an extra 10 years to see my grandkids longer, that's all I need you to tell me. And then, I'll be happy. I can make this change in my diet and stick to it. And I said, here's what I can tell you. If you have maybe 100 friends and family members and they all change their diet this way, 90% of them would live that extra 10 years. But I can't tell you what's going to happen to you. Right. You could walk out after this conversation and get hit by a car. So it's very hard to know on the individual. And this is what makes it tough for us as humans. We're sort of programmed to kind of to survive in the world, to see things and connect the dots. And so we see something and we're quickly, we're by evolution, how do we survive? We see something and we learn from it right away. And we jump to conclusions, and we're just really good at sort of putting together the dots to reach a conclusion. But the reality is, of course, sometimes we're right and sometimes we're wrong. And so you burn yourself on a stove and then you never touch a stove again. That's not really the right answer. But you can see how people jump to that conclusion. So we do see things in ourselves. We see them in other people. And then we sort of conclude that this is the case. What's allowed humans to be as successful a species as we are is because that's how it works for animals and them. But we were able to take it to the next level, which is we were able to share that information among each other and then figure out that we can actually do studies and do this on a bunch of people and then figure out, is this really what's going on or not? And so some of the time it turns out that your hypothesis is right. And when you actually study this, this is what's going on. And this is a great thing. This food contains this poison and people shouldn't eat it. But other times you find out that no, that's what you saw. But actually, when you study it in a bunch of people, turns out that's not the case. That's a rare side effect. But actually, this thing's really necessary and you want to keep it. You only can learn those things through doing the science. And that's what allows us to answer the questions. And so there's a lot we know, there's a lot we don't know. But and you're asking all the right questions. But some of them I can answer for you because we have done the science. But the number one problem here in America is we don't do the science because the industry has a conflict and doesn't allow us to. They use the political power to keep the science from being done. So many of the questions you're asking, the answer is we don't know because we're not doing the science.
Yeah. I mean, do you think too, though, that just being able to experiment with food on yourself and kind of how you feel, that is a good indicator? I mean, because I know if I eat a bunch of crap junk food, I'm going to feel like crap pretty in a few hours, a lot of times, definitely like the next day, and sometimes for several days after. Whereas if I eat something healthy, I usually feel better.
Yeah, no, I think it is good to do that. I think it may help a little to write it down somewhere. Because sometimes this is a problem with food poisoning. One of the jobs I held in government was overseeing, the kind of food safety where you eat something, the hamburger that causes E. coli poisoning and diarrhea, for example. It turns out, when you do those investigations, some of those microbes, you eat it and you get sick within a few hours. Some of them actually take a couple of days. Now, but for the person, and this has happened even in my own family, people had the experience where they ate something, they got sick, and now they have an aversion to that food because they think it made you sick. Right. But I can tell them based on if you do, once you get sick, if you ask the doctor to take a sample of either it's a little messy, it's either the vomit or the poop, and they run it to a lab, they can actually say what bacteria was making you sick. And then based on that bacteria, I can tell you, how long ago you were exposed to it, because different bacteria takes a different amount of time. So in some cases, you might be right. If it's something that made you ill quickly, you think it's this. But a lot of them, you're not going to get sick for 2 days. And yet, when you finally get sick in 2 days, you're going to say it's what I had for dinner last night, because that's how your brain is thinking. And so now you've developed an aversion to what you had dinner last night, whereas the thing that made you sick was what you ate 2 days ago. But we can figure that out with science, because we can culture the bacteria that's making you sick, and we can give you a sense of when, how long it would take that bacteria to cause illness once it's in your body. And then you can think back about, and this is what we do when we do investigations. So it may be depending on the illness, it's not what you ate last night. I want to know what you ate 2 or 3 days ago. And that's how those investigations take place. And that's how we solve those investigations. But you have to do that. And you can see, though, how as an individual, it's hard to do it just by yourself, because the conclusion you're going to draw is what I did last is what's causing it.
Or maybe you have to try it for you could try carnivore diet for 30 days, try vegan for 30 days, try Mediterranean for 30 days, and then you'd have.
Yeah, I encourage people to do that and see what effects it have on you and see what makes sense. And, I think it helps to work with a health professional sometimes and take blood tests, because you can see at that level what's going on as well in addition. But, absolutely important. Your subjective sense of how you feel about that's important as well. But you need to also look at, some other measures are helpful to see as well. I think that's important.
Yeah.
One other complicating factor is also, you mentioned that it actually turns out some of these keto diets, we talked earlier about Chris Palmer, seem to be more effective around mental health.
That is really fascinating to me. Yeah.
And that's documented, and I'm sure that case is real. And so then that's something else you have to weigh, and a lot of different levels, whether you're lactose intolerant and therefore you can't have dairy. Well, what things would I miss if I'm not? If I'm gluten sensitive, if I'm not eating bread, what could I be missing? And so I think those are things sometimes you have to work out to figure out what you want to eat.
I'm trying to do kind of like a Mediterranean, but high protein still. Like it's because that's
actually that's what I eat, but but I get the protein mostly from seafood.
Yeah, you're pescatarian. Yeah, I remember we talked about that. Yeah, because that's another thing that's like everyone in my gym is, telling me to eat more protein, and it's really hard to get like 200 grams of protein from just eating
Yeah,
regular
yeah,
food.
that would be hard.
Is there dangers to having too much protein on the kidneys?
No, you're right. Again, yes. And so you do want to be careful about that. And if you're going to eat, anytime you're really going to do something that I think of as sort of more out of, if you look at a normal, what would happen in a distribution, I want to get a little bit out here in the tails, because it might be useful to also, take some blood tests and other things along the way to see if, what's the impact that's having.
Yeah.
And you might want to do, urinalysis and stuff and see what's happening, to your kidneys. You might want to get some of that other data that you might not notice yourself if you're going to do something that really would not normally occur, but you're sort of forcing it to occur.
Yeah, I do think that I'm definitely adding more fiber back into my diet. That's one thing. And just, I mean, I think for most people, I feel like, and that's what you're kind of talking about from a public health perspective, for most people, you could say eating a lot of fruits and vegetables, minimal or zero processed food, watching the saturated fat and the sugar intake, and maybe not having too much red meat. I mean, I think those are all it's going to be, for the most people, it's going to make them healthy.
Yeah, and then if you and you can think about it that way is exactly right, and then you can also think about it. I am most people, I'm hoping, and so for most people, if they do that, they will experience that. But if it's something that in your life you're more interested in, you're willing to spend more time on it, you can take it to another level and start saying, "But what about for me? Am I really sure this is working for me?"
Yeah.
And there are things you can do about that. You can learn more about it. You can work with a dietitian. You can work with another healthcare professional and say, "Can we do some experiments here? Can I learn more about this? Can I fine tune this a little bit?" And if you enjoy doing that, absolutely you can do that. But a lot of people, have a lot of other things they'd rather be thinking and worrying about. And at one level, if you do these broad things, this is what's most likely going to happen. So if you decide that you're going to all of a sudden eat just red meat, the odds are you're going to really up your risk of getting a heart attack. That's going to happen to you.
For the average person, yeah.
For the
But
average
for some
person.
maybe
Yeah.
and for like,
Maybe
I know like the Jordan Peterson and his daughter, I mean, they
Yeah,
cure
yeah.
these autoimmune things. And so for them, it's like, it seems like maybe even if they did have a higher risk of heart attack, curing the autoimmune thing gives a better quality of life.
Absolutely. I think, I trust them. I think that those are real experiences that people have. And again, but when you have billions of people on the planet, you're going to find just about everything.
Well, and then somebody told me that the reason that they can eat a lot of red meat is because they're of Nordic descent. And so so that you look at your genealogy, you can kind of really get into the mess here.
And that definitely, the genes have an effect, but your genes have, in terms of health, your genes have an effect, but it's a minority effect.
Yeah.
Your environment has a bigger effect.
It's a fascinating topic for sure. Are you now, since there's a new administration, are you trying to get a job with the RFK?
I'm trying to influence them. I'm really excited, as I mentioned at the beginning, that they have made this a political priority. This being chronic disease, our safety of our food, the entire "Make America Healthy Again" movement is something that I'm optimistic about. But then I'm going to wait and see. The problem is if there are other things the administration is doing that gives me a pause. And so, for example, I know that if you really want to make America healthy again using food, and as we've just been discussing, you're going to have to invest more in science. You're going to have to be willing to use that science to maybe write some regulations because the marketplace isn't giving the companies the incentive to make the food healthier. And so there may need to be. So the levers that I know work best for some of the things they're trying to do are funding and regulation. But then elsewhere in the administration, they've said the things they intend to cut are funding and regulation. And so I'm struggling a little to see how you connect that. And I'll give your listeners an example that has just happened in the last couple of days. And so there's another part of the administration that's cutting government. The DOGE part of the new administration cutting government. And they're trying to show results as quickly as possible, which, I get why some people would want to do that. And they're taking advantage of a sort of, I'll think of it as a loophole in government. When we hire people, one of the things we do in government, we created a system where in the first year you're hired, you're on probation. And really, it's just something, in my time in government, it's rarely used, but it gives us as a manager in government a do-over if we make a mistake. So, and you know, it hadn't happened in all my time in the jobs that I held, but I can see that it could happen. I know it happened to other people. You hire someone, you realize this person is not working out, and I've made a mistake, and I just missed this, that for whatever reason. I didn't check the references well. I don't know. Maybe it's just some random thing that happened, but it happened. And so now I have this brand new employee that I've hired and I want to get rid of them, but I can't because they have civil service protections, which are needed to have people, to choose government as their work. And so we created this sort of probationary period that allows me to fire someone anytime in the year. Now, what I also know from my experience in government is that the people who we usually hire are the most energetic, excited, hardworking people on my workforce often, right? They're brand new, they have full energy, they want to do that. They're potential future leaders there. They don't all become leaders eventually, but these are the sort of the new excited people you bring on, right? That's my usual experience with them. Now, this cutting effort sort of said, well, gee, what we care about is being able to show we can cut as many people as quickly as possible. And so they've sort of said, well, let's take advantage of this probationary period and fire everyone who's still in their probationary period, because we can do that. And then we can show we've cut all these people. All right, well, that's, I wouldn't cut those people because, as I said, often they're the best people in the workforce in terms of energy and new ideas and trying new ways of doing things. But here's, in particular, around this MAHA, Make America Healthy Again. The last time we talked, we were still going through a process, and we learned that our Food and Drug Administration had fallen into disrepair. And we learned it when there was an infant formula crisis where we didn't have enough infant formula because the way that FDA was managing that issue. And so as a result, it got everyone's attention. Everyone got on board on trying to do something about it. They did investigations. They reorganized the entire food program at FDA. And a year and a half ago, they hired somebody to, now take this reorganization and make the agency successful again. And at the top of the list, the person they hired was an expert in chemical safety. And so their number one issue, they came from the Environmental Protection Agency, and their expertise and what they spent the last year doing is building up the chemical safety program at FDA. So they went out and hired a whole, 10 top scientists, one for infant formula, 2 a neonatologist. All of these people they hired in the last year who are experts in chemical safety, who are now going to help us make our food safer through that. Now, along comes this other effort in the administration where they just want to cut people, and the people they are easiest to cut are the people hired in the last year. So they just fired all those people.
Yeah,
and so
it
here,
is. I do like that they're cutting because I think there is a lot of problems, but I do think this is one area that should leave this one alone. Well, and maybe they need to cut some of the people who aren't good, but like you said, why would we cut the people who just hired? Cut the guy who's been there 40 years, who's just waiting for retirement. Give him.
Maybe you don't want to do it to someone who's just retiring, but you do. But I can tell you, as a manager, if someone came to me, it's government. You're one of the challenges in government that you don't have when you're running a business. If you're running a private business, you have your customers, and some customers just may be not very cost effective to serve. They're just difficult. They cost more money to serve. And so if I'm running a lean business, I might decide, you know what, they're just not going to be my customer. They're too difficult. Now, when you're in government, your customer is the American people, and they come in all shapes and sizes and illnesses and conditions. And your job is to serve all of them. And you don't really, it's not a business, you're not just saying, I'm going to only serve the ones that are easy to serve. You want to be able to help everyone that needs help and when they need that. And plus, you want to prepare for things that are problems. And so you build a certain amount of redundancy in programs. You keep people there who maybe, they're people who've done a great job. You're right. Maybe they've sort of checked out a little bit. They're waiting to retire. You have a whole range of different people. They're still great performers. Less performers are in there. People are in different places in their lives. They must have once been really excited about the job. They've gotten interested in other things, and they're sort of mailing it in at this point. You know about all of that when you work there. You see all those people you work with every day. I can tell you, if someone came into me and said, look, Jerry, we may disagree on this, but I want you to cut 10, 20% of your workforce. And but I really do care that nobody is hurt. And so can you work with me to figure out, and I may say to them, look, some people are going to get hurt if you do 10 or 20%. And they may say, but Jerry, that I made that promise. I think in the long run, that's going to be better for the American people. Fewer people are going to get hurt. Let's work together to get to 20%. And I can assure you that they're in every government agency I've been in, they're the pros who work there, the best people. You could have gone through that. It would have taken a few months. It might take 6 months, but we could identify together to get to that number, whatever your number you're going to set.
Sure.
And there may be some decrease in services, but what I'm sure of is I will retain all my best people.
Yeah, that's definitely
right.
I
I will
don't think
retain
it's
my
even
best.
cutting jobs necessarily is the best way to cut funding. I mean, I feel like we could cut a lot of the military. Do we really need all these bombs and all this stuff? I mean, that
That's the thing, but that's a process. You kind of work through it with the
Sure.
people who are the experts, and you sort of figure out, how do we do this?
Yeah.
And so whether it's cutting just dollars out of a program, cutting people out of a program, we can work and do this in the smartest possible way. So if you come to me and you say that, look, one of the things we really want to do is we really want to strengthen chemical safety because it hasn't been a priority in decades, where here is this other area that has been a priority and maybe it can afford being less of one for the next few years. We can say, all right, let's take some of the people out of that program and let them go, and let's bring on the chemical safety people. But the way that we've done it now is the only metric we've used is whether they were hired in the last year.
Right.
Now, here's the problem with using that as a metric. As I said, disproportionately, if you're going to hire someone, you're going to fire the person hired in the last year, they're probably one of your most energetic, creative people, because that's just the nature when you hire someone new. You have their 100% plus attention. They're doing their best every day because they know they're new and they want to make a good impression regardless of a probationary period. They bring new ideas. It's great. So they have that. So you want to do that. But now here's what's happened, because there's a ripple effect to what they've done, is that by letting go these people, who's going to replace them? Because when you go out and say, all right, now I want to hire someone else to do this job, as I start thinking about it, because I didn't mean to cut out all the chemical safety people. I need a new person. Who's going to take that job? Because they're saying, well, what happened to the predecessor?
Mm-hmm.
You fired them, even though they were brand new and they had an exceptional work rating. You just fired them because they were in their probationary year. I'm not coming to work there in a probationary year. And the other ripples happen as well. Some of the best and brightest people at these agencies look at everything that's going on. They can get jobs anywhere. They're going, I'm going to go work somewhere else. And the people who you disproportionately retain are the people who feel like, I can't get a job somewhere else, so I'm staying here as long as I can. And so just taking a process where I'm going to fire the people who are the easiest to fire because they've been there the newest, it seems kind of counterproductive. And then on top of that, they've also set another policy saying for the agencies, now that you want to hire new people, for every one you have to want to hire, we're going to make you cut 4 more. And so, it creates a great disincentive not to hire new people, because, maybe I can cut 1 or 2 more, but if I have to actually cut 4 to get 1, that doesn't seem like a good deal. So we've put ourselves in a difficult position overall, but in particularly in this one area, what we're here to talk about today, which is the excitement, the RFK Jr., the Make America Healthy Again. I think for that movement, the number one issue for many of them, rightly, we talked earlier, is the chemicals in our food, the effects they're having. And
I think when you look at the cutting, I think, to me, because I worked in education, so I saw just there was so much bloated, just so many people, like this person fills out this form, and a lot of paper pushers, that a lot of administrative people in the school district offices that just had these jobs with made up titles that did nothing, and they would have these 6-figure salaries. Those people get cut fine. Yeah. The person who's the chemical safety expert, like, yeah, we need that person, but the person that's processing their forms or whatever, or that's overseeing this thing or whatever, like, we don't need all that stuff. I feel like that is the
and so the way you achieve that is you have to identify who's who, right?
Exactly.
And so you need and trust me, they're people. It's not a conspiracy. They're people. They're pros in every agency that will help you do that. There may be some who say, I don't want to be part of this.
Maybe they just want to start with their own people, which I guess RFK's been an environmental lawyer for 40 years, so he knows. I mean, he must have connections and know some people he can
Well,
bring
you can
on.
bring in your own people, but the
Yeah,
challenge of that is you've worked in an organization. If you replace, there's room for some new people, but
sure.
if you replace all the old people, the new people are going to spend quite a bit of time figuring out, you know,
Right.
simple things that the old people could tell you in a minute.
Yeah. But
And
you'd
so
still go, you'd still take a job if they offered it to you.
for me, it depends on it. Right
Oh,
now, it's. I feel like I can be most helpful, and be most involved working from the position I am. But I also, when I look back on my career, the best jobs I've had are the government jobs I've
hmm.
had. So I in general want to, feel like I'll never say never. I always want to work in these government jobs because they're just incredible in terms of what
Yeah.
you can get done versus somewhere else.
Oh,
But I am also watching the sort of damage that's being done and the people that are being heard, and I worry about I don't want to be part of that, so I'll have to.
sure.
I'm waiting to see how this progresses.
Okay. Great. Well, anything else you want to promote here?
Um, if we have a minute, and it makes a long session, but I wanted to raise one other topic with
Sure.
you that I think is really interesting for people, and the field of public health that I work in, when I learned about it, studied, things are often based on the laws of the land and that, and so where does public health come from? Where did it get its start here in the United States? How did it develop? And it turns out there was around 1904, there was a Supreme Court case. It was around smallpox and vaccines. The case is called the Jacobson versus Massachusetts. And essentially, the state of Massachusetts wanted to force an individual named Jacobson to get their smallpox vaccine, even though they didn't want to get it. And it went all the way to the Supreme Court, and the Supreme Court ruled that no, in America, the state has ability to use its police powers to force you to get vaccinated, even though you don't want to, because it's necessary to protect the most people. So we're going to put society first ahead of the individual. This was the law of the land in this Supreme Court case, and it's what public health has always been about. Which is we have the power to tell you to do something you may not want to do. We can quarantine you. We can force you to get a vaccine. We can do all these things if we can prove that this is necessary to protect the greater number of people in society, and we'll take care of you the best we can. And if indeed if this vaccine kills you, we'll compensate your loved ones for that, and we hope that we'll take every precaution. But as a society, we just feel like we do need to protect the masses. And so that's what I was taught when I was a student in public health. This is the whole basis of public health. And indeed, when we found ourselves with COVID, I think the professionals in the field felt like this is this is the rule book. We have the Jacobson versus Massachusetts. We're dealing, this is real time. A million people are going to die. We need to act quickly. Vaccines, other things are going to help masks, and relying on that Jacobson versus Massachusetts model, we can just plow ahead here and do this. Now, what was interesting to me was before COVID, back in 2017, when I left government and went to work in academia. Again, I was going to teach a course in public health, and I planned to teach Jacobson versus Massachusetts as the basis of public health. And so I called up a constitutional scholar, friend of mine at another university I had worked on, and just sort of checked with them and said, I'm going to teach this class. I'm going to teach Jacobson versus Massachusetts. I just want to make sure I don't have that wrong, that that's still something that I need to, can use. And the funny thing is, he says, no, that's not the law anymore. And I'm like, wait, what did I miss? What is the defining law that we need to worry about? And he said, it's a case called Griswold versus Connecticut. Now, I'll help you here. I don't expect you to know what that case is, but Griswold versus Connecticut is where we got the right to privacy. And it had to do with birth control and whether the state can interfere with your own private decisions in your bedroom.
Hmm.
And it's a case called Griswold versus Connecticut. Well, I was confused when this law expert told me that it's not Jacobson versus Massachusetts anymore. It's Griswold versus Connecticut, because I just never made the connection. What does that have to do with public health? And he explained it to me. He said, Jerry, if the Jacobson versus Massachusetts, and this is before the current Supreme Court. This is back in 2017, before Trump added 3 more conservative justices to the court. He said if Jacobson versus Massachusetts came to the court today, it would not decide it that way. And why? Because the America today, the individual comes first, not society. And so we've evolved as a society where individual rights, freedoms, the ability for you to do what you want to do has risen to such a high level that when confronted with, do we just do this because it's right for society, or do we do this because we the individual comes first? We side now today as the individual comes first. Can you relate to that? Because I think that's the case. And so here's why it all matters. And then I'll give the floor back to you, is that if we understood this going into COVID, so it's not that you change the policy. It's not that you're going to want people to mask or you want people to get vaccinated. What's changed is that you don't have the right to just demand it because of the law. You have to kind of explain it to people and get their permission. And I think that's something we're going through in society right now, is that a lot of people in my field of public health are still sort of in a Jacobson versus Massachusetts mindset, where they feel like I can just say this and tell you have to do it, because I'm in a crisis and I don't have time to talk to you about it. And I'm just going to tell you need to do it because that's what we need to do to protect the most people. Whereas I think that as a society, as individuals in that society, we expect something, we feel we have the power here. And if you want me to do something, don't just tell me I need to do it. You need to explain it to me and get my permission. But you don't have the right to just make me do it. Well, and I think that's a really important shift. Does that make sense to you? Or
yeah, I mean, I think to me that was the whole point of this country, was like everybody left because they wanted to do their own thing. I mean, it was more based on religion, I think, was they didn't want to worship a queen or whatever. They wanted to worship their God. But I mean, I guess the difference for me too is I feel like that original case you're talking about, smallpox. I mean, smallpox, I feel like that was I don't know the exact statistics, but I'm assuming that was a much more deadly disease than, I think that was the problem for a lot of people with COVID, was like, okay, this has whatever it was, less than 1% death rate. And, most people that are younger can get it and they're not going to die. And then the vaccine came out, and then it was like the vaccine didn't really prevent you from getting the disease. So that was a little bit confusing. And then, like you said, it was an experimental thing, so they don't know the long-term effects. And so there was a lot of other factors when you're talking specifically of COVID. And I think that's why it was such a controversy. I feel like if it was a thing like, okay, this is Ebola, and here's the vaccine. If you take the vaccine for Ebola, you won't get Ebola. If you don't take the vaccine, you're going to get Ebola. You wouldn't have to make a law, because people would just go, yeah, of course, I'm not an idiot. I'm going to get the Ebola vaccine because I don't want to get Ebola. But it was not as clear cut. It was I think that we did handle it wrong. I think what they should have done, I'm not a public health expert, but to me, it just looked like we just kept this whole lockdown thing, and it just kept delaying it. And I feel like what they should have done is they said, if you want to go out there and get it, hey, go out there and get it, because then that waters it down for the other people that are at risk. And then we would have herd immunity, because that's what ended up happening anyways. Everybody ended up getting it. People that got the vaccine, people that didn't, we all ended up getting it. So why not let the people that were either young and healthy or stupid enough that they just wanted to go out and risk it, let them get it. And then that way, when it comes to me, I get the watered down version. I'm getting a less strong COVID. And so I just found that weird that we were saying, no, these college kids, like, no, you need to lock down. It was like, well, what was the long-term? Were we just going to lock down forever? Because to me, that just didn't make sense.
Yeah, no, you're right. I think you make a lot of great points there. And I think the challenge was it's in real time, and you're trying to, before you know what's going on, trying to predict it.
That's what's so interesting. My buddy, because I remember when the whole thing first started, I said, we need to lock down. And my buddy said, why? You can't. I said, no, because if we lock down, then we'll stop the virus. And he goes, you can't stop an airborne virus. You're not going to be able to stop this. And I was like, no, you're wrong. The news said if we lock down, we'll kill it. And he was right. And he's just a guy. So how did he know this? I mean, he is one of my smarter friends, but how did he know that we weren't going to be able to stop it? He's like, this is based.
Well, no, actually, that's interesting. You should ask him that, because the point you made about being an airborne virus, early on, we didn't know that. Some people hypothesized that, but it was a while till we figured it out.
Well, I think he just said a virus. He said, you can't stop a virus.
No.
And I was
because initially you might recall, right? There was a period where we were like wiping everything down.
Right. Yeah. I remember that. Wiping, wearing gloves and stuff. And
we had to be like 6 feet apart.
Yeah.
Right.
Which was, they said was a made up number. It was an
Well,
arbitrary number.
it wasn't not quite meant, but it was sort of the idea was that there were different experts, and some of the experts who happened to be in charge at CDC and WHO at the time understood a certain way that a lot of viruses operate, where it's more like it requires contact. The virus
Yeah.
has to be in a large droplet. It doesn't travel. It just doesn't travel in the air. It travels in droplets that are fairly large. It's when you touch things, that it's a model. These are both models. It could be either one. It's just initially we picked the wrong one,
Hmm.
and
But
it
didn't
took a
they
little
know?
bit of.
Because wasn't it a virus that they were studying? Didn't that eventually come out that it was something that they were studying in labs? And that's
No, I mean, again, there's
Yeah.
different versions, but it turns out in this particular virus, and what we know now is that it was principally airborne,
Hmm.
which means that it can float in the air for a long time,
Yeah.
and it can travel a long distance. And we didn't know that initially. So 6 feet isn't far enough. Masks are actually more important than people realized,
Well, but the
particularly
thing
for
with the
you if you
mask
wanted
that
to
I didn't
protect.
understand was that they said that it happened. Most people that got it, it was from being face to face with someone, having a conversation in the droplet, like for like 20 minutes. If you talk to someone for 20 minutes, you're not probably going to get it from walking by somebody for 3 seconds, right? So
Yeah, no, well, that was
and it
the
was
first version of the first
yeah,
version. So
because the
it turned
exact
out.
opposite was the advice was when you walk by someone, you need to be masked. But when you sit down and have 20-minute conversation, you take the mask off. And to me, that would seem like it'd be the opposite.
Yeah, no, I don't know if anyone said take the mask off, but I think what we knew initially
When you
in
went
the
to a
virus.
restaurant, that was the rule that you take the mask off.
Well, you can because you're there, and you can't have to take it off to eat.
Yeah.
But what they said initially, the initial, so COVID evolved, right? It kept changing as a virus. But the first version of it that we had, turns out that you couldn't get it outdoors unless you had a 20-minute face-to-face conversation. So I think you're referring to that. So if you just walked by someone outdoors, if you just said hi to them, there was no need to really wear a mask. There's no need to be really worried about outdoors because it required more of an exposure than you're going to get with the dilution of the air outdoors. So you
Right.
really
Yeah.
had
Because
to.
all the people that wore the masks that were strict on masks, they did end up getting COVID because again, eventually you got to take the mask off when you're with your
Well, so
family,
here's
your
Chuck,
friends.
and then I got to run, but and you do too, I'm sure. Here's the a mask. So there are two kinds of masks, and I know that just because of my work. So I worked at the Food and Drug Administration, and we regulate what people think of as masks, what I think of as masks, which are these things with the two air loops that are sort of a piece of paper. They expand out. It's what you see when you go see the doctor. Usually,
Sure.
they're a mask, and the FDA regulates those because what those masks do is they protect the patients. And so the purpose of those masks are that they don't protect you, the person who's wearing it. I mean, it provides some, but the main thing is to make sure doctors don't make their patients sick. And so
Right.
that's why it's an FDA regulated product. It's a mask. It's done for that. And
You
the
don't
main thing it
spit
does.
and sneeze on your patient when you're working.
Yeah,
With the
exactly. It
dentist.
just
I just
really
went to the dentist. She's got a mask on the whole time. Yeah.
Exactly. It cuts down on that. So that's that kind of mask. Now, there was another thing that people use these interchangeably, but they're really completely different. But when I think of as a mask, as a regulator, those are the things FDA regulates that keeps, doesn't protect the wearer, it protects all the people around the wearer. And people use these in other countries as well. When you're sick, you wear a mask, and that way you don't spread your illness around as much. You wear this mask. Now, there's another thing. When I worked at OSHA, there's another kind of mask. We refer to them as respirators. And so when you hear about the N95s and all of those things, those are respirators. Now, there are jobs, and an N95 just means 95%, right? You're protected. There's N100s. I don't, during the COVID, I don't know if you knew that, but there's N99s, there's N100s. It just depends. And what those respirators are designed to do is that every day, there are a lot of people who work in environments that there's no safe exposure. If you get exposed even to a little bit, you're going to get sick and die. And so we develop these masks, respirators that are designed to provide, if necessary, 100% protection. In most cases, when you're dealing with viruses, 95% is good enough. But there are a couple of things about them. First of all, to work, they have to fit right. They have to fit really well. And you have to learn how to do that. And they actually teach you, and they put you in a room where there's a smell. You go in there and you put it on, and you work with it, and you keep learning to do it till you learn how to put it on so that you're getting a really good fit. And it's not that hard. A lesson, a couple of attempts, people can learn how to do that. But so in the world, there are two types of masks. There's a respirator that's designed to protect you, and then there's a mask that you wear so you don't make other people sick. Now, in the beginning of COVID, I think the government did a disservice because these respirators, we didn't have enough of them. And so we started just calling them all masks as if they were one thing, and not really distinguishing between the two different kinds of masks, respirators versus, masks, and letting people know. And so if we had been more, better job informing people, here's what we would have told people, and they should have understood, is that if you feel you're at high risk and you really want to do something to protect yourself, you need to get hold of one of these N95 or higher respirators and learn how to use it. And if you do that, you can protect yourself, because we do that every day. There are people, if they get any exposure at all, would die, and they don't, because they've learned how to wear respirators. They wear them in their workplace, and they use them safely against both microbes and also chemicals that can be really toxic if you get any exposure at all. So we know how to do that. We create that because people work in those dangerous jobs, and we can protect them, and because we have that, and it's referred to as personal protective equipment, or PPE, is the way you deal with that. But then we also have a whole other universe of masks, which we use in doctors' offices and others to keep you from making other people sick. And those are things that you can really are easier to use, more at a population level. Just when people are a virus, they may not know they're infected because of the nature of this virus. So this is a way that you're not really protecting yourself. You're protecting yourself a little, but you're really more protecting other people when you're wearing those masks. And so that, I think you'll agree that wasn't really described clearly to people. And so they didn't.
Well, first they said masks don't work. Remember that? But then that's because they didn't.
Yeah, no, again, that's what I'm saying. What is it that you're asking? So if you're asking what would protect you, only an N95. And now here's how it gets complicated, because the government, in a way, didn't have enough N95s. And so then we made a decision. For example, we gave priority to healthcare workers.
Sure.
Which made sense, except for what about all the people who work at meatpacking plants and other places where they're being forced to go to work? I know, because I oversaw work. They all have N95s at their workplace as well, because in their environment, with working with all these animals and things like that, they wear them to protect themselves.
Sure.
Now, they all of a sudden lost access to those masks. And we saw there was an outbreak where they started, those workers and even the government inspectors were dying from COVID because they lost their masks. And so that's where there was a period of time where you said, if everyone locked down, there was actually a need for a period of time till we could get the supply chains back in place to provide people with what they want. But what should have happened is then people should have said, the question is, do these surgical masks protect you? No, they really don't. They protect you to a degree. It's better than wearing nothing. But, it's not designed to protect you. They're designed to protect someone else. And but that other person, if they really want to get their risk down as close to zero as they need, it's not enough to rely on you to protect them. You need to get one of these respirators. Does that make sense?
Yeah, absolutely.
So I hope when I explain it, and I don't know, for most people, I don't think that they've ever had that kind of explanation. And so I think they came away confused about what's a mask. And I see it all the time now. I see people who I know are trying to protect themselves, who are healthy, and they're wearing a surgical mask. They're not.
Or they're wearing a handkerchief or something, or a dirty underwear.
It doesn't work. If you want to protect yourself, but early on in COVID, I had this. It was really hard to get a respirator because they were all sort of
stacked up, ready for the next one.
Yeah, and so they were hard to get. It was good that we were locked down, because for a couple of months there, I couldn't get one, and then eventually I could. Anyway, always great to talk to you.
Yeah, great stuff. Fascinating topics, fascinating information. I think I learned a lot. Hopefully my listeners did. And good luck to you. Whatever happens, if you get a job with RFK, tell him to do my podcast. And if you see Chris Palmer, tell him to do my podcast too. I think I tried to get him on. He said he was too busy though. So.
Well, he has. I'm an academic. Not that we're busy, but he actually sees patients as his primary job, and so the choice for him is, see another patient or talk to you. So he does some podcasts, but he does have to see patients every day.
Yeah, I know. He picked Rogan over me. I understand. That's fine. But Thanks again so much.
Cutthroat business.
Yep, absolutely. Thanks again.
Okay. Yeah, bye-bye.
Bye-bye.
Topic, one of a kind. From the rockers to the wise men.